generalized anxiety disorder. So here generalized anxiety disorders are those in which anxiety is unvarying and persistent. Here in generalized anxiety disorder, it is a type of neurotic disorder in which anxiety is unvarying. So here unvarying means anxiety it is being remain same in patient. Either it won't get increases or decreases. And this persistent means long duration we can see this anxiety. Phobia and all, phobia, patient will get anxiety only in particular time whenever patient will come into contact with the phobic stimulus. But in generalized anxiety disorder, unvarying and persistent anxiety we can see. And this generalized anxiety disorder, it is a common type of neurotic disorder, and most frequently we can see this one in women. Next we see etiological factors. So here what are the etiological factors means? First one genetic theory, second one biochemical factors, third one psychodynamic theory, next behavior theory, and last one is cognitive theory. Next we see etiological factors in detail. So here first one is genetic theory. So this genetic theory explains through genes or hereditary how this disease condition we can see within relatives. Here in this generalized anxiety disorder, it is most commonly seen in relatives of patient with this condition. According to this genetic theory, GAD commonly seen in monozygotic twins. Monozygotic twins means twins those who have similar physical characteristics. In such twins, any one twin got affected by this GAD means another twin also having 80% chances of getting this disorder. Next is first degree relatives. So here first degree relatives may be our parents, our siblings, or our children's. So here to whom we have blood relationship. So here any one of such first degree relatives got affected means there may be chances of getting this disorder 15 to 20%, 15% to 20%. Next etiology it is biochemical factors. So in this, alteration in GABA level will lead GAD. Here GABA is one of the neurotransmitter which is responsible for our mood. If any variation in GABA will lead mood disorder or it can produce anxiety. So it will lead generalized anxiety disorder, GAD. Next, psychodynamic theory. So this theory states that failure to use repression defense mechanism will lead GAD. So here repression is a type of defense mechanism in which we forget our past painful experiences unconsciously. In case of GAD patient, failure to use this repression we can see. Because of that what they will do means they will recall again and again their past painful, shameful experiences, so that again it will produce anxiety in them. So this will lead GAD. Next is behavior theory. According to this theory, giving unconditional response to painful stimulus will lead GAD. Means whenever we got hurted by something or someone, we'll show some of the emotional responses like sadness, anger, anxiety and all for a particular period of time only. So after that we become normal. But in case of GAD, they will show these emotional responses for a long duration. Maybe more than 1 day, 2 day, 3 day, 4 day like that. Okay. So this will lead GAD. Next is cognitive theory. So according to this theory, faulty cognitions or our negative thoughts will lead GAD. Next we will see clinical features of generalized anxiety disorder. So these clinical features, it is classified into two types. What are those means? Psychological signs and symptoms and physiological signs and symptoms. Next, psychological signs and symptoms. So this includes fear, irritability, sensitivity to noise, which means whenever patient exposed to loud noise or any sound, patient becomes angry, anxious or irritable. Next, poor concentration, worrying. So these are all the psychological signs and symptoms of generalized anxiety disorder. Next, we see the physical symptoms one by one, system wise. They are, first one, gastrointestinal symptoms like dry mouth, difficulty in swallowing, epigastric discomfort, frequently loose motions are common in GI symptoms. So why this epigastric discomfort and loose motion will occur means whenever we become anxious, in our stomach hydrochloric acid it will get increases. When it get increases, slowly it will start burning our GI tract. So commonly we can see epigastric discomfort like pain in abdomen, heartburn, loose motions and all we can see. Next, respiratory symptoms like constriction in chest means patient feel tightness in the chest, so that patient feel difficulty to take breathing or else over breathing also we can see. Next, cardiovascular symptoms like palpitation and discomfort in chest. Next, genitourinary symptoms like frequency and urgency in micturition. In this case, patient will go to urinate many times as a because of anxiety. Next, failure of erection means erection problem during sexual intercourse in male we can say. Next, menstrual discomfort. So in this painful and bleeding, heavy bleeding occurs during menstrual cycle. Next, amenorrhea, very commonly seen in genitourinary symptoms. Next, in neuromuscular symptom, we can see tremor. So here tremor is an involuntary shaking movement or shivering movement of the body. Commonly we can see in hands. Next, prickling sensation, which means when you pricked by a tiny needle or a pin, how you feel. Such sensation it is called as prickling sensation. Next, tinnitus. So here tinnitus means some whistling or buzzing sound, going kind like sound we can see in ear. Next, dizziness means feeling of giddiness. Next, headache, muscle ache are commonly seen in neuromuscular symptoms. Next, sleep disturbances like insomnia, night terrors and other symptoms like depression, obsession, depersonalization, derealization are commonly we can see in GAD. Next we see diagnostic evaluation. So in that first one, based on signs and symptoms. Here based on manifestation of anxiety, whether it is unvarying or else persistent, how much time it will take, how much time it will remain in patient. According to that, we can diagnose it as a which type of anxiety disorder it is. So next diagnostic evaluation, it is ICD-10 criteria. Based on ICD-10 criteria, we can diagnose which type of anxiety disorder it is. Next, we see the treatment for this GAD. So in that first one is pharmacotherapy. Here, in GAD, anxiety is a main symptom. So that to reduce anxiety, anti-anxiety drugs are very useful. Suppose if patient is having depression means to reduce this depression, anti-depressant drugs are used. Other than this, pharmacotherapy, behavior therapy, cognitive therapy are very effective to treat this GAD.